a crisis talk. Yes, a crisis talk to educate Nigerians on the need to have good sanitary conditions. And we're going to be taking a look at what Water Aid Nigeria is all about, what the crisis talk is all about, who they'll be talking to, and about what. And it's my pleasure to welcome on Kakaki, the African Voice, this Thursday, Bisi Agberemi. Bisi Agberemi is a water, sanitation and hygiene specialist with UNICEF Nigeria. Thanks for coming on the program. A good friend of the house, somebody you know pretty well unless you're new in town, Dr. Otive Igbuzo. Dr. Igbuzo is the Executive Director, African Center for Leadership, Strategy and Development Center here in Abuja. Doc, nice to have you in the studio once again.
It's my pleasure.
And Kabir Yari, I hope I got that right, is the National President of the Nigerian Institute of Town Planners here in Abuja. Town planning and efficient and effective water supply do have a lot in common, so we're going to be looking at all that. Nice to have you on the program.
It's my pleasure.
Okay, Bisi, I'll start with you. A child dies within 20 seconds across the globe as a result of poor sanitary conditions. When I first saw that, I thought it was a typographical error on the script. 20 seconds. How is that true, and how did we get to that situation?
Thank you very much. It's actually true, because one of the direct consequences of poor sanitation is diarrhea. Diarrhea kills children very, very fast. And in environments where we have poor sanitary conditions, the children are subjected to this condition, and of course, the direct consequence is diarrhea diseases. And diarrhea disease is one of the major killers of children. So actually, we have this very high mortality rate because of poor sanitation. So it is true. It's happening.
It's happening.
It's
okay,
happening.
Doc, I mean, diarrhea, deaths from diarrhea, these are decade-old diseases. I mean, why, after so many decades, with so much talk, so much money sunk into, I mean, health-related issues, why does the problem still persist?
I think one of the key problems why it persists is that enough priority has not been given to water and sanitation across the world. And another clear reason is the fact that there's a lot of poverty. You know, over 1 billion people in the world today live below poverty line. And there is a relationship between poverty and lack of access to sanitation. Unfortunately, and I think this is the sad part, governments all over the world, particularly in Africa, have tried to deal with the other challenges, other health challenges, like HIV/AIDS, you know, malaria, and other challenges that affect people. But water and sanitation has not been given the priority that it deserves. Meanwhile, water and sanitation affects the other areas of life. There has been a lot of talk all over the world about the need to achieve the MDGs. But water and sanitation is supposed to be a catalyst that will help to achieve the MDGs. When there is water and sanitation, it has a relationship with poverty, it has a relationship with infant mortality, which is one of the goals. It has a relationship with education, because when there is water and sanitation, it increases attendance, it increases enrollment and completion. But if you look at Nigeria, for instance, you discover that only 32% of the population have access to sanitation. So about 103 million Nigerians do not have access to sanitation. Yet, the resources that government have put to water and sanitation is just 0.18% of GDP. And it has been shown that if we want to make any progress, Nigeria has to increase it more than 3 times. So basically, why we are in the situation we are in is because there has not been enough priority given to water and sanitation. There has not been enough funding. You'll be shocked to hear this. That as we speak, there is no approved water and sanitation policy for Nigeria. What we have is draft. And we know that if you are faced with any problem in the world today, there are things you need to do. You need to have a policy, you need to have a strategy, and then you need to have plans. Luckily, all over the world, water and sanitation problem is not just a problem to Nigeria. So people all over the world have been looking for ways to deal with it. There's a high-level meeting on water and sanitation that takes place periodically. The one of 2010, Nigeria was not there. There's another one which is happening in April 2012. We hope, really, that the crisis level of water and sanitation in Nigeria will be recognized by the present government. Even if you look, if you look at the MDG, the monitoring and evaluation report of the National Planning Commission of 2010, the Ministry of Water Resources did not achieve its targets for the Vision 2020. So there is but luckily now, I think we have a very dynamic minister at the ministry who appears to understand the issues.
Doc, we're going to get back to this issue of policy. Let's bring in the town planner. It's very easy to heap the blame on the health authorities for this water and sanitation deficiency. But shouldn't we put some of the blame on the town planners? I mean, look at the sources of water, streams, boreholes, all these archaic forms of getting water, whereas what we know happens is there are sophisticated water pipe networks which pipe water to houses. But there seemed to be a move towards that a couple of decades ago, but it looks as if everything appears to have gone to sleep. Shouldn't we put some of the blame on the town planners?
Well, if you look at it, let's look at it from the planning point of view. Planning point of view is that when you have problems of sanitation, problems of hygiene that you are talking, usually when you have a planned environment, that is, all those things have been taken care of, how to dispose the excreta, how to dispose the feces, and you find out this sanitation system is in order. So once you have good planning, you find out that your system may be better. But what is it happening in Nigeria as we have today? In Nigeria as we have today, 60% of the population in all cities in Nigeria, over 60% is living in informal, unplanned areas. When you have informal, unplanned areas, that is, most of them are characterized by slum. And one of the characteristics of slum is lack of adequate water and sanitation. So you find out that, yes, one day 60% of your population lives in slum. And the slums usually are made, they don't have water and sanitation. You find out that is the big problem because they don't have toilet facilities, they don't have piped water. But even the informal areas, you call some areas they call informal areas, yes, but they get piped water from the network. But it's not a planned reticulation. It is somebody who will do, another will extend. The problem, you find out that usually the pipes burst, and if it is area where you have high water table, by the time the network in the city, because most of the cities we don't have water 24 hours a day, when there is no water, then there is sanction. Contaminated water gets into the pipes, and by the time the water board brings the water, it is contaminated, it's diluted. Second, you find out that in most of the informal areas, the slums, they don't have good toilets. So what do? They defecate outside. And when they defecate outside, those are the problems of sanitation that we're talking. Most of the diarrheal diseases are caused by unhygienic handling of feces and human excreta.
Okay. Doc said something about Nigeria not having what exists is just a mere draft policy on water and sanitation. And as the water and sanitation expert with UNICEF, I'm sure UNICEF probably isn't looking at Nigeria with smiles on its faces.
Yeah, thank you very much. The last policy we actually have is dated back to 2000. So we have an approved 2000 water and sanitation policy with the help of all the stakeholders to help in providing the necessary framework for developing the sector. But you agree with me, from 2000 to date, a lot of emerging things have come up, and this policy needs to be reviewed to face the emerging trends in the sector. Since that time, the sector or the ministry have been struggling to ensure that this policy is actually revised or revised. But again, up to now, most of the policy we have are still in draft form, apart from the water and sanitation policy. Having said that, because we are talking about sanitation crisis, because for me as a person, I work in the area of sanitation. When you combine water and sanitation together, you are further making sure that sanitation itself suffers most. Because at the end of the day, water enjoys political attention. Sanitation does not even attend anything at all. So because of that, because the last policy we had in 2000 had just a paragraph or two on sanitation. It's purely on water. And that really compounded the burden of sanitation in Nigeria. Yeah. So because of that, the stakeholder recommended that we should have probably a standalone sanitation, and all these policy again are still in draft form. In addition to that, because sanitation is cross-cutting, you cut across several ministries and organizations. The problem we are even having now is that each of these organizations, like environment, health, education, water resources, have their own individual policy. And most of them are at conflict. So
all policies on sanitation?
All on various aspects of sanitation. Okay. It's part of the crisis.
So there's obviously a need for harmonization of that.
Exactly. Okay. So what we are trying to do now is to bring all these policies together towards having one single harmonized sanitation.
And when you say what we are trying to do, who are these we? Really?
The we is stakeholders.
Okay. And who are these stakeholders?
Of course, the government agencies, the NGO, the development partner, because as I said, it's not a fight of government alone. We are all affected in one way or the other. I work for UNICEF. Children are dead to us. Children are dying. So we have to make sure that we have all the necessary instruments to support sustainable sanitation development in Nigeria. That is why we are involved.
Because the reason why I asked BC all those questions, because we keep hearing we, stakeholders, everybody's coming up with suggestions, but nobody's getting anything done. So my problem, I think, is that, I mean, we need to start pinning these things to specifics and pinning the responsibilities on specific people. Now, this draft policy you're talking about, I mean, it's pretty worrisome. But this is a dangerous situation, and I think something needs to be done immediately. Doc, in your view, as an immediate first step, what should we be doing?
We need leadership from government. Stakeholders, yes. Development partners, UNICEF, Water Aid. There are several organizations on water and sanitation. But government needs to take the leadership. Take the leadership, bring all these agencies together. You know, it's really amazing. Like we said earlier, in Nigeria, diarrhea is the second biggest killer of children after malaria. So diarrhea kills more children in Nigeria than HIV/AIDS, for instance. But the level of priority and attention is not given to it. The level of funding that is required is not given to it. The level of policy and planning that is required is not given to it. Because, you see, like UNICEF, like Water Aid, and other development partners, if there is a policy, if there are credible plans, you will see organizations coming to even support the process. Yeah. So the most important and urgent thing that needs to be done is for government to take the leadership. And I think the Ministry of Water Resources is better positioned to do it. And like I said earlier, they have a new minister who I think understands the issues because of her background and her pedigree. So I'm expecting an accelerated work in that regard. Take the policies are already in draft. Yeah. Take the policies, get all the stakeholders together, harmonize the policies, get it approved by the Federal Executive Council, and they have a clear work plan, credible plan to implement the policy and begin to ask for more allocation of resources. Because we are talking of the life of our people here. Yeah. Because all the other efforts to achieve the MDGs, if the water and sanitation issue is not addressed, it will come to naught. But there is also a very big aspect, which is that of participation by citizens and community participation. We've done some, and Water Aid and many organizations, including ours, have done a lot of projects in the communities. In fact, in the last 1 year, we've done projects in Durumi communities, in Ruan Fulani community, and in Kizi community, all around the FCT. This, like President mentioned, these are slums. In these places, people don't have toilet, so they defecate openly. When you defecate openly, flies will get the, and through orophical transmission, the people have typhoid, they have diarrhea, and there is high level of disease burden in those communities. What did we do? We just came and sensitized the community, trained the community on what needs to be done, and what happened? In Durumi community, when we started, there were only about 4 or 6 toilets in the entire community. But by the time we exited the community, they have built 60 toilets. So there is a lot of things in terms of behavior change that does not require a lot of money on the part of government. Because government will not build toilets for all individuals, but that they can start the process. You remember, we used to have sanitation officers in those days. They need to start a process of participation of citizens, so that citizens will get to realize that the diseases they are having, the disease burden, is as a result of part of their sanitation habit.
Okay, can we bring Presido into this, because he was referring to you. Obviously, there's also a lot of work that the town plans have to do. I mean, where do you think you're going to get started to key into some of these things that have been mentioned?
No, I think what is most important, as they mentioned, actually, to have a change of attitude and we have to have an action-oriented program. It's not just a policy, but a policy that is action-oriented, it is tied to implementation. One other thing is that the federal government, yes, has the overall key policy issues, but water and sanitation is divided across so many tiers of government. You have the state government, you have the local government, and you find out sanitation is local, it's on-site sometimes, because most of our cities, what we do have is on-site sanitation. That's what we have, the septic tank, the pit toilets. But you find out that there is no city. Abuja has tried, actually, you have central sewer. But so many other cities don't have central sewer because problem of water, problem of lack of planning right from the beginning. Because sewer depends on gravity. You don't need to pump the water to do other things. But if you don't plan, but if you are to have big urban centers and the population is growing very fast in the country. So if you are to accommodate high density development, if you are to accommodate more people, sometimes you have to use off-site systems, general sewerage treatment plants and whatever. That's the only way. If you have a hotel of 50 rooms and, 500 rooms or 1,000 rooms and all of them will flush their toilets, you can imagine if there is a septic tank. Or you imagine the difficulties we have in some areas. If you look at riverine areas where the water table is high. So some of these on-site things we are saying. So these are the issues that policy has to do. But it's not only to mobilize, I mean, as the non-governmental organizations have been doing well, but they need the support of the governments, particularly the state and the local government, so that people will integrate into their development the provision of sanitation, particularly toilets in their house.
Okay, you see, Otiva said something about awareness, and that's probably the reason why this crisis talk that we're talking about is coming up. Now, basically, what are you going to be talking about and to who?
Yeah, thank you very much. I think when you look at the major challenges as enumerated, one of them is the low political will. So the awareness starts even from the political leadership for them to appreciate the importance, the cross-cutting issues we are talking about, that this is something that affects our lives. If we do it, it helps us to achieve every other thing. We are not even talking about disease burden. The effect of poor sanitation on the economy is there. The World Bank report says that Nigeria loses 455 billion naira annually due to poor sanitation. So from both sides, you see that we have to target this, the policymakers, and we now come down up to the household level in terms of awareness creation. And luckily, as us in the field, what I say, we have the approach. He has mentioned something, which is excellent, very good. We have the approach. We know what to do. We need a enabling environment with the support of the government, giving these Democrats adequate support in terms of logistics, in terms of funding, to fund these tested approaches. Let me give you an instance. Community-led sanitation is a simple approach, cost-effective approach that is working in more than 43 countries all over the world. this approach has been introduced to Nigeria and is resolving the sanitation crisis in rural areas. Yeah. We are just coming from a conference in Katsina. We just came back. And the result we are getting on this approach in resolving the sanitation issues in rural areas is very, very encouraging. What is left is for the government to take it up, fund it, and let's scale this thing up. And before you know it, the sanitation issues can be resolved. And we even believe that with community-led sanitation approach, which is cost-effective, we can still achieve our MDG sanitation targets in Nigeria, if and only if we can have adequate resources.
Now, Doc, again, I want to pin this thing to specifics. He talked about political leadership. I'm sure you're not just referring to everybody. Since it's a talk, of course, you're not going to have all the political leaders. Who are you targeting when you're talking about the political leadership?
You know, when we talk about political leadership here, the target, first and foremost, is the Minister and the Ministry of Water Resources. But we have also mentioned that we require a lot of funding. So Minister of Finance is also very important in this issue. The Director General of the Budget Office, and of course, the Federal Executive Council as a whole. Because this is a matter that if you deal with it well, you know, it will affect all other sectors. If there is no water and sanitation, no matter the budgetary allocation to health, it will come to naught. You get the point. And like he mentioned, the approaches are already there. They are well known. The community-led total sanitation approach. The three communities where I mentioned earlier, that was the approach that we utilized. And it's a very simple, cost-effective approach. You don't need to go and build a toilet yourself to them. It's just to make the people realize the importance of it. And the money they will have spent in treating diarrhea diseases, the money they can divert those money in improving their own sanitation. The only thing people need to know is the awareness. So the people really is to target the government at those specific level, Ministry of Water Resources, Ministry of Finance, the Federal Executive Council as a whole, because they need to know that they have a responsibility to approve a new water policy and new sanitation policy for Nigeria, because it's the Federal Executive Council that has to do that. But the main responsibility for driving this rests with the Ministry of Water.
Just before I let you go, I don't know who's going to answer this question. These crisis talks we're talking...
Let me just add something.
I'm going to give you 30 seconds to do that, if you don't mind.
What is the National Assembly, too, is very important when you're talking about political leadership, because they will be the one who will approve the budget.
Okay, right. So when we're talking about these crisis talks, are we talking of a one-off, 1-2 hour discussion, or it's going to be a continuous dialogue of some sort? Because we're going to be beaming our searchlights and we're going to be looking for the outcomes of the discussions. When are they taking place?
Okay. It's a continuous thing.
Okay.
It has to be continuous. Sanitation is not a felt need.
Absolutely.
Both at high level and the low level. So we have to come to talk about it. And we believe that in as much as we're going to talk about it, one day that thing will be done. So all right. It's a continuous thing.
Okay, we're just going to have to leave it like that. We just hope it doesn't end up with the talk. Because when you say continuous talk, you get me worried. Because Nigerians are tired of continuous talk. They want less talk, more action. But when you say continuous talk, you get us worried. But don't worry.
Action.
We are beaming our searchlights on those talks, and we'll be reporting to Nigerians as things unfold. Many thanks, gentlemen, for your time. We've been speaking with Bisi Agbiremi, who is a water sanitation and hygiene specialist with UNICEF Nigeria. Dr. Otive Igbuzo, the Executive Director of the African Center for Leadership, Strategy and Development Center here in Abuja. And Kabir Yari is the National President of the Nigerian Institute of Town Planners. And we've been looking at the worrisome statistics that we have, that a child dies every 20 seconds across the globe due to avoidable poor sanitary conditions. And from what we've gathered, it's likely to become a thing of the past. Once again, gentlemen, thanks for your time. And we just hope that everything you've planned worked according to that plan. It's Kakaki, the African Voice, this Thursday. We'll take a break. The discussions continue.
Didn't know you could have